All right, it is 2 o'clock, and I want to welcome you to the ITS America Mobility on Demand Alliance webinar, MOD in the time of Corona. My name is Shailen Bhatt, and I am the president and CEO of ITS America, the Intelligent Transportation Society of America. And I thought for this call, because Amy Ford, who is our director of the Mobility Demand Alliance, is in Colorado. I would go to Colorado as well. And this little halo on my head is actually the strong Colorado sun beating down upon me. It's not a light in my bedroom. But hopefully all of you are doing well, are safe at this time. I think that I think back to life as we knew it, a couple of months ago, and things that we thought were really big problems or really big challenges have been dwarfed in many ways by the current health crisis that is affecting our country. And so from an ITS America standpoint and mobility on demand, we've thought about how our organization, which is a group of private sector companies, public sector agencies, and research institutions who are united in this vision of a better world transformed by intelligent mobility, one that is safer, greener, and smarter. And, how does mobility on demand play into that? And what I wanted to just kick off the call with today is this, this idea that everybody keeps asking, when do we get back to normal? And I think we're all coming to the realization that, normal, whenever we get back to it, is going to be a new normal. Things that we used to do and things that we took as commonplace activities are going to look a lot different. And from a transportation perspective, we want to understand when we come back, how do we take transit safely? What does ride sharing look like in the new post-COVID environment? What about electric bikes and scooters and all the things that we're transforming urban mobility? How do we incorporate those things safely? And then lastly, the thing that I would just focus on is that, there have obviously been a lot of horrific outcomes from COVID-19. There are, over 40,000 Americans who have lost their lives. The economy is in pretty dire straits, and we have to fix those things very quickly and get us back working again as a country. But I think that from an ITS America perspective, what I'm incredibly interested in, what we're going to be having conversations with thought leaders like some of you on this call, like many of you around the country, is when we come back, how do we not come back with all the negative outcomes and externalities that were sort of taken for granted before COVID-19 from the transportation sector? So as an example, we've been losing about 38,000 people a year on American roadways. What do we need to do from a transportation perspective so that when we come back, our new normal does not include 38,000 fatalities a year? And I would say from a mobility on demand perspective, I think the urban mobility piece and how we are scooting and biking and being pedestrians in urban environments and how we can do that safely, that's a key focus. Before COVID-19, one of the things that we were pretty used to was spending 100 hours a year sitting in traffic. So when we come back from COVID-19, whether it's through an increase in telework or through making sure that transit is a strong entity going forward, that ride sharing and other things are continuing to be part of the solution. How do we ensure that when we come back, we're not sitting for 100 hours a year as Americans in traffic? I think that's something that we can really make a difference in right now. And lastly, I think that for me personally, this COVID-19 exercise has been, I think, a real harbinger of some of the challenges we might face because of climate change. Obviously, COVID-19 exploded in a very short period of time, but many of us have been talking about climate change and the insidious effects of unchecked carbon dioxide in our atmosphere. Well, one of the externalities that we took for granted before was that 28% of American greenhouse gas emissions were coming from the US transportation sector. So whether it's electrification or just a much smarter way of traveling, and mobility on demand plays a large role in that, how is it that we design our system as we come back from COVID-19 so that we don't take it as a given that we're just going to continue to spew out CO2. So these are some of the questions that we're grappling with at ITS America. And we really look forward to our leaders in the Mobility on Demand Alliance. We've got a great lineup here. And I'm going to turn it back over to Amy, who's actually in Colorado, to take it away. So thank you very much and stay safe. Amy?
Thank you, Shaylin. And unfortunately, my background is not outside. Otherwise, you wouldn't be able to see me, but just the great mountains behind. But we just wanted to thank everyone who's joined the call today. And as we go into today's discussion and webinar, I know that a lot of webinars are happening. There is a lot of time commitment that it takes to participate and join in these. And what we're really hoping is that not only do we have a great discussion about what's happening with mobility on demand in the time of COVID-19, but also really look to the future and to the future of what our gig mobility really has in store for us. And, you know, when we talk about the Mobility on Demand Alliance, you know, some of you might be familiar with us as an organization, some of you may not. And, you know, under the umbrella of ITS America is really about how transportation has been transformed within the last several years, frankly, within the last decade. You know, the silos that we've traditionally had in transportation and mobility have been breaking down, and we have new providers and mobility service providers, frankly, who weren't here 10 years ago. And as we talk about how we manage that future of mobility, as we strive for this world that's safer and greener and smarter, it's how do we bring together our public-private sector partners, our academics and others, as we continue to forward seamless mobility and really the benefits of mobility on demand. And, you know, address some of the things that are challenges and the opportunities. How do we engage our policymakers? How do we think about regulatory barriers? What do we think about partnerships? How do you create different frameworks and address some of the challenges that are there in mobility on demand? Things like automation or payment or equity issues and accessibility or data sharing. I think very few of us anticipated that we would be talking about mobility on demand in context of a global pandemic. And frankly, that's what we're here to do today is, you know, there's been a lot of talk about what is happening to transportation right now as we see the decline in transportation, the decline in riderships. Yet at the same time, we recognize that mobility on demand has been revolutionizing how people move. And with COVID-19, whether we're calling Lyfts or Ubers or hopping onto a scooter or a bike or jumping into a microtransit system, that while these mobility transportation services have really transformed how we've been moving in the last several years, they've also equally been dramatically impacted by what's happening with COVID-19. In some instances in cities, they're deemed as essential services and very much a part of the mobility and transportation landscape. In others, they've been shut down. In others, we're partnering with transit as we provide services to essential workers and the like. And today we're so excited really to have a great discussion in front of you. And, you know, I wanted to introduce our speakers as we got going on all of this, but I want to explain a little bit about what this webinar is all about. So to begin, I wanted to welcome really some of our mobility service providers who are going to be joining us talking today. Chris Pangilinan, he is the head of global policy for Uber and head of global policy for public transportation. He's going to join us with a few comments. Lily Shoup, who's the Senior Director of Transportation Policy with Lyft. And then Brian No, who's also the Head of Public Policy with Spin. So these mobility service providers and these private partners who really have been revolutionizing mobility and doing quite a bit during COVID response. But we also have public sector partners on the phone, and we're thrilled to have Carol Cooper, who's Managing Director of Market Innovation with King County Metro Transit Agency within the area of Seattle, who is really responding rapidly to what's happening. And then also other private sector partners, John Horner, who is Mobility on Demand National Practice Leader with Kapsch, people who are behind the scenes sort of fueling how we create mobility services on demand. And so when we talk today, not only are we going to be talking about what's happening right now and how people are responding, but we're also going to be talking about what this means for what I'm going to call gig mobility, you know, and especially, and this is part of the conversation, if investment and how we think about how we jumpstart the economy relies on transportation, what does that mean for on-demand mobility? But let me comment just a couple of quick things on logistics. So as you know, I think this is very few of you's first Zoom rodeo now, and you know that we're going to be asking our guests really to do just sort of a short 5 to 7 minute review of what they're doing and how they're responding and a bit of their post-COVID perspectives. And we're going to break this up though, because we really want to be able to engage you with your questions of our panelists, either questions that you submitted when you registered or actually here on the fly and live. So I want you all to go onto your screen, and as you guys know, if you click down below on your toolbar, or perhaps it's off to your side, you're going to see 2 buttons, one of which is a Q&A button. That is the button that if you want to click on that to ask questions, what we'd love for you to do is to be able to ask questions of our panelists. And the way we're going to start this is we're going to have our first 3 panelists. We're going to have Chris and Brian and Lily present briefly, and then we're going to go into a Q&A session with them, as well as Carol and John, and invite them into that discussion. But as you note on my slide, I don't just have the presenters there listed as being part of this webinar and discussion. I have you listed. And the reason for this is that you all are as many of an expert and have thoughts and opinions about what's happening as do our panelists. And I'd love to be able to engage in that interactive discussion. So the way that we're going to do that is I'm going to be asking you guys a few questions about your thoughts about mobility on demand, so it can help jumpstart some of our discussion. And frankly, it also helps us frame some of where this might go in a post-COVID world. So the second button that I'm going to ask you to look at is the chat button. And I'm going to be shooting you a note and a question. And when I ask you those questions, I would love for you to be able to type in and respond. And when we're in that chat function, everyone who is online, and I apologize for those of you who are on the phone, and we will certainly be sharing this out verbally so you can engage that way, but that you can see what your other attendees have to say and thoughts, and ask our panelists to sort of weigh in on some of those thoughts as well. I also may even ask 1 or 2 of you to join us through audio and talk a little bit more about your comments in this chat functionality. So as we get going today, I really wanted to turn it over then to our MOD service providers to kick this off. And so I was going to ask Chris if he could sort of present in general for how Uber is working and responding right now. And then I'm going to have Chris turn it over to Lily, and she in turn will turn it over to Brian. So Chris, why don't you take it away?
Thank you, Amy. Hi, everyone. Good morning, good afternoon to you all. Really appreciate the opportunity to speak here from ITS America, and wanted to thank Amy and Shailene for the opening remarks. As Shailene was talking about, was mentioning, I think he is absolutely right that we have a really interesting opportunity here, of course, first to weather the storm that we're in, but also to see what exactly does the new normal look like and how do we get there during this time. And Amy was absolutely right in that it's not just the panelists here who are speaking, but all of you in the audience. I looked through all the participant names, and there's so many of you who know a lot about this topic. And so any of you could be obviously speaking as well. And so looking forward to the rich discussion that we'll have after all of this. So I'm going to be speaking briefly on Uber's response to the current coronavirus situation and some of the work that we're doing specifically on the area of public transportation. So our response in the immediate onset of the virus was threefold here, and that is 1, supporting the public health and safety situation of both the folks who are on the Uber platform, as well as people in general in the cities that we work in, as well as supporting frontline and healthcare workers in vulnerable communities, and of course, finally, supporting earners, communities, and the local economy. On the public health side and the safety side, one of the major things that we've been working on, and I'm glancing here at my notes just so we know where I'm looking, is on our helping our drivers and delivery partners, as well as our riders with handing out masks, getting masks and other sanitizer equipment delivered to the folks on the platform, pushing in-app messages to tell people that they need to stay at home and travel is only for essential purposes, as well as suspending Uber Pool. And so we only have the single ride products out there, or single party ride products out there right now to help with the social distancing mandates. In the frontline and healthcare workers, we've done an area where we've put forward a 10 million ride donation initiative for frontline workers, healthcare workers, and vulnerable populations, as well as Eats deliveries. as well. We've also done something what we call Uber Medic, where in Europe, we're actually helping give a discounted ride to people who are in the medical profession, the healthcare profession, to get to work during this time. And finally, on the last aspect, as you know, Uber Eats has been a huge part of this part as people have been sheltering in place to get food delivered, and also working with public transportation agencies, which I'll dive into a little bit deeper. So in the public transportation world, a lot of you are probably familiar with this, but this is a quick recap. We work with public transportation agencies around the world to do services like first last mile or on-demand public transportation or coverage routes or coverage services, excuse me, to help complement fixed route public transportation. And what's interesting now is, as you can imagine, a lot of public transportation agencies are facing multiple threats now, not just from reduced ridership, but reduced fare revenue, and also longer term reduced tax revenue due to cities and states suffering from the economic downturn that's resulting from the shelter-in-place orders. And so what we're trying to do now is position ourselves to be able to help those public transportation agencies and have them be able to come to us in order to provide essential services that they need in their communities. And so one of the ways that we're doing this now is through our partnerships with public transportation agencies. You would probably seen with Miami a couple weeks ago and with Indianapolis just earlier this week to help provide essential transportation services to people that are still having to go to work. So of course, medical workers, grocery store workers, anything like that. And those agencies in Miami are subsidizing rides overnight when they had to suspend overnight bus service. And in Indianapolis, for people that are still having to go to work off-site, so not at home, within the county. And so through mobility on demand services, they're able to reallocate some of their bus service to where they can either put it on more routes to keep social distancing alive, or to respond to operator shortages, unfortunately due to a lot of operators having to call in sick during this time. And so this is a way that mobility on demand and public transportation can work together in order to keep transportation services going during this time. But there will be a lot of challenges to consider and questions going forward. So once we get through this intense period of lockdown and get into a more, I guess, a new normal, what would that look like? Questions that we're trying to ask here, and I'm looking forward to the discussion here, is how will the coronavirus potentially accelerate public transportation shift toward mobility management? Will mobility on demand and public transportation become more of a partner hand in hand in order to allow transit agencies to deliver the same amount of services or more under extreme revenue pressures, both from the state and the federal and the fare revenue? And then also exploring what shifts in policy might be necessary in order to keep transit afloat during this time of reduced revenue and social distancing, and can they lean on mobility on demand to help make that less painful? And finally, a big question about this new normal that we're getting into: can cities, with all the progress they made over the last 10, 20 years, resist the rush to public-private cars again, like we're seeing in China and other places that are recovering from COVID right now, and still encourage public transportation, shared rides, and micromobility options that might have fallen out of favor during this time, and prevent ourselves from getting into a situation where we have more car deaths on the roadways and have more environmental issues and have more just private cars taking up space that we lose for walking, biking, and other active modes. And so I'll leave it at there, and I look forward to the discussion. Thank you.
Great. Excellent. It all works. Thanks so much, Chris, and to ITS America for having me today to talk about Lyft's response to the COVID-19 crisis. While many Americans shelter in place, critical workers, so our first responders, transit workers, grocery store workers, still have essential travel needs. And over the past few weeks, Lyft has announced a number of efforts to help people complete these essential trips while practicing social distancing. Lyft Up is our program to expand transportation access to those who need it most. Through the Lyft Up program, we partner with leading nonprofits around the country to provide free and discounted rides to individuals and families who lack affordable and reliable transportation. In response to the COVID-19 crisis, Lyft has activated more than 500 Lyft Up partners to provide thousands of rides all across the country. I'll mention a few highlights here, but please do check out lyft.com/liftup to learn more and get in touch if any of these programs would be of assistance to you in your work. So first, we're partnering with transit agencies, school systems, and labor unions and nonprofits across the country to give rides to vulnerable communities with essential transportation needs right now. For example, we know the crisis is disproportionately impacting communities of color, and Lyft is partnering with civil rights organizations like the NAACP, National Action Network, and the Urban League to distribute ride credits to these communities. We're also working with Medicaid agencies in 10 states, plus the District of Columbia, to expand rideshare access to non-emergency medical transportation for up to 30 million people as they get to and from health services. Second, we've begun to facilitate the contactless delivery of food and medical supplies to families in need, seniors, and those with chronic illnesses. And then finally, we're offering free bike and scooter trips to those working on the front lines, like first responders, healthcare workers, and transit staff. The Lyft Critical Worker Program uses our two-wheeled options to provide an essential service in our communities right now. So through this program, we are offering free 30-minute scooter rides for critical workers in our major markets there. And this is alongside the bike share programs we've already put in place with city partners, where we're offering free bike share memberships for critical workers in networks where Lyft is operating, such as City Bike in New York, Divvy in Chicago, or Cabby in DC. Within just a couple of weeks, we saw over 100 organizations and hospitals in 11 cities across the country sign up to take advantage of these programs. And you can see just a couple of quotes from people who are already benefiting from this program and the important impact it's had on their lives already. So in responding to this crisis, we have tried to keep a few goals top of mind. First, make sure that we're supporting our cities and our communities. 2, supporting our critical workers in our community, and then 3, to ensure the safety of the Lyft community. So I'll just talk quickly about New York. In New York last week, we actually worked with the city to install a new city bike station adjacent to Columbia University Irving Medical Center. This is at 169th Street in Fort Washington. It will serve healthcare workers uptown and provide them with access to the city bike system. And we're already seeing tremendous demand at this station just within a week. We have also aggressively increased or are repositioning our existing bike valets to the stations adjacent to hospitals with significant ridership to make sure that people have the access to city bike when they need it. We've aggressively increased our cleaning protocol to help protect the safety of the community using the city bike system. Our typical cleaning protocol is to disinfect high contact surfaces every time a bike is returned to the depot. Now, in addition to that, bikes are being cleaned every time they touch a valet station, and we have a large team of field mechanics cleaning bikes at stations that they visit with a focus on high traffic areas. And you can see a couple of tweets here of folks who've been thanking those workers out in the community. And then finally, wanted to reiterate, we're using our platform to alert people about key safety and public health updates. We're partnered with the National League of Cities to gather important updates about shelter in place and curfews, and also to remind people of the basic public health practices like washing your hands and avoiding close contact with others. This is really an unprecedented time, and we're looking forward to working with our city partners, with you all, with ITS America and other partners to think about what a recovery looks like and what's next for our communities as we emerge from this crisis. As we prepare to look ahead, now is a time to reinvest in walking, bicycling, and transit, support temporary infrastructure changes on the ground, and ultimately to build more resilient transportation systems that include mobility on demand as an important backstop to public transit and other systems. ultimately, we're all going to be able to go back to work very soon. And when we are, Lyft is ready to support people and the trips that they'll be making. So thank you for the opportunity today. And now we will hear from Brian No.
See if I can figure out how to change the slides. Great. So my name is Brian No. I'm head of public policy at Spin. Lily, thanks so much for passing the baton to me. First of all, I hope everyone is staying safe and healthy during this time. And for those who might not know, Spin is a shared micromobility company. We're based in California, and we had been operating in about 70 or so markets across the United States. And we are actually a wholly owned subsidiary of Ford Mobility. So I thought it might be helpful just to give a quick overview of what Spin has been up to and how the pandemic has affected Spin and shared micromobility. So just in terms of safety, obviously, we need to take care of our employees, and we need to take care of the people who are entrusting us with their safety. So we have increased disinfection frequency of the scooters. All of our employees out in the field and in our warehouses, they wear PPE, including face shields. And at the end of the shift, we have a protocol now in which we disinfect every high traffic surface or touch point, whether it's in the warehouse or out in the field. In addition to that, we've provided additional paid leave benefits to our employees, including our hourly employees, in the case that they get sick, or they may get sick, or they think they might get sick. Because we have an all W-2 workforce, we're trying our best to make sure that we don't remove the opportunity for them to, we don't take away their access to healthcare during this time. So in places where we have suspended operations during COVID, we've actually decided to provide paid leave for up to 12 weeks or so for the time being until we can figure out next steps. And so in terms of operations, it's not a secret to everyone here, but ridership has plummeted because people are staying inside as they should. And because of that, we sort of had to make the painful decision of shutting down temporarily operations in a number of markets, most of our markets, in fact. At the same time, though, we are continuing to operate in about 9 or 10 cities, Baltimore, Denver, Detroit, LA, Portland, SF, Tampa, and DC. And we're actually in the midst of reevaluating and evaluating which other markets we might be able to resume operations sooner rather than later. So more news to come on that. And what we're also doing is thinking of creative partnerships that we can do to help cities and our communities during this time. So we're working with several cities right now so that we can provide scooter access to essential workers. And we launched an Everyday Heroes initiative for frontline healthcare workers, in which we are providing free 30-minute rides and free helmets in the active markets where we are currently operating. And we've actually been pleasantly surprised by the positive reception that we've gotten from the participants. Individuals are free to sign up on our website. And just in the first couple of weeks, I believe we've had about 1,000 individuals sign up for our program. So we're really excited that people are relying on our scooters to get to and from pharmacies or hospitals. And we're also working with cities and transit agencies to sort of help fill any transit gaps that are being caused by reduced transit operations. So throughout all of this, I think what's been kind of heartening for us is that our desire and our goal to make shared micromobility a true piece of the urban transportation network be validated by our city partners. Cities and states across the country have made it very clear that not only is shared micromobility an essential service, a critical infrastructure piece during this time, but they've actually encouraged us to oftentimes step up and to try to help ensure access to mobility for their residents when other forms of mobility may be more prone to spreading infection. And it kind of makes sense, right? You know, I think having this sort of free floating dockless model allows us to have nimble operations where we can sort of adjust things here and there and respond to certain locations where demand might be higher than normal. And because it's an individual form of transportation, we also think it is a safer alternative than perhaps getting on crowded subway cars or whatnot, or taking a shared Uber or a Lyft ride. And the other thing is, you know, we're really excited about the fact that this can really be perhaps, you know, if there was a silver lining to this, it's that cities are finally reallocating a lot of public space for people and not cars during this time. And what we want to do is to figure out how we can sort of help create a bigger natural constituency for safe streets, so that this is not a trend that's just a flash in the pan during COVID, but it's sort of a trend that has lasting effects across our streetscape. So a couple sort of high-level observations that we've been seeing in our markets. Obviously, there's been a sharp decrease in the number of trips. You know, that's not surprising. However, what we've been interested to sort of see is that the average trip distance has increased a lot, which sort of indicates that people are using this for instance, everyday commuting more so than recreation. A couple other sort of high-level general trends. You know, in few of our cities, we've seen actually a percentage increase in trips starting or ending at pharmacies. In SF, we've seen about a 10% increase in trips starting and ending at restaurants. And in Baltimore, we've seen an increase in trips starting and ending at grocery stores. And in addition, in Baltimore, we've seen a large proportion of our trips take place in equity zones, which are underserved areas traditionally. To get a little bit more detailed, I thought I'd share this sort of before and after map of San Francisco. The map on the left reflects trips in January, and the map on the right is after the shelter-in-place order was instituted. So it's about, you know, March 17th to April 7th. And what we've been seeing is that there is a change in travel pattern. And it seems like a lot of this shift in travel pattern stems from the fact that people are using this more for commuting purposes, or less so for commuting purposes to the financial district, but getting around their neighborhoods. And we also think, because if you look at the Embarcadero, there's a market decrease there. That probably reflects reduced tourism. Let's see. Sorry. So I think in summary, you know, are there creative partnership ideas or opportunities that are worth exploring during this new normal? We think the answer is yes. You know, this is an unprecedented challenge. There is no quote unquote playbook for what shared micromobility should or can do during a pandemic, but we are in constant conversation with our city partners to figure out ways that we can be of assistance and provide a value and mobility access during this time that ultimately is sustainable in the long run for both us and the community. So a couple quick ideas that we've started to explore. Can we partner with transit agencies to help fill gaps temporarily during reduced transit operations? Can we help fill the gap that's going to be caused by reduced transit ridership in general because of a wary public? We're exploring monthly rentals for essential workers. And we're also working with some cities to see, can we reduce fares for essential workers? And in lieu of that, the city might be willing to sort of reduce some of our permit fees. And in addition to that, we are going full force ahead with our Safe Streets initiative. So just today, for instance, we just launched our Build a Better Barrier Challenge in partnership with Team Better Block, in which we're calling on individuals and teams from across the world to submit their ideas for new and improved creative barriers that we could pilot across the country. And this is sort of a direct result of the COVID crisis, where we're seeing cities turn to quick build projects to reallocate street space. And we want to be there to help and expedite that. So in summary, thanks so much for having me, and looking forward to continue the conversation and happy to answer any questions.
Thank you so much, Brian, and we really appreciate it. Folks, feel free to ask your questions on the Q&A side of your bullets. And I see some of you are putting them into the chat as well, but sort of let me start with some of those questions that have come in. And we'll move this one off right now. This is going to be the question that I ask you guys. But if all of our panelists could come online, that would be great, because I'm going to ask questions, frankly, of all of them. Of all of you. You know, the first questions I think that we're getting are both for Chris and for Lily too. And the questions about shared mobility, so ride shares and the emphasis on that. And, you know, what does this mean right now for Uber Pool and for Lyft's carpool programs and the shared rides that we've been seeing? Obviously, they're not happening now. Do they come back at all?
Yeah, I can start there. Thanks for that question about shared rides. Yeah, I think they will. The situation now, obviously, is that it's you know, with social distancing, we have to reduce the number of people in cars and vehicles. But you know, coming out of this, there will be still a lot of demand for transportation that is economical, that is environmentally more sustainable than single occupancy vehicles, and so the need and the desire for something like a pool service will be important. And especially it's going to be important as we look into how mobility on demand can potentially support public transportation, like Lily and Brian were both alluding to as well. And so pool is a big part of that. And I think as we start to get more comfortable, I don't know when that's going to be, but when we get more comfortable again with sharing space with people, I think we'll see a resurgence of those kind of services again.
Do you think the same, Lily? As you know, I think a lot of people have some questions that we'll get into with Carol as well about sort of the partnerships of on-demand rides, but then inevitably, what does that mean if it's just single source rides? And obviously transit being sort of focused on air quality issues and shared rides and sort of what those partnerships might look like too. But
yeah, I would just echo what Chris said and say, you know, we are passionate about the shared rides that the shared rides program that Lyft offered, and excited to bring that back in communities when we are, you know, working in conjunction with city partners and with the CDC. It is safe to do so. We, you know, as Chris said, you know, we believe the shared rides and increasing the occupancy of vehicles is critical to ensuring the, you know, environmental and community outcomes that we all want to see. And so really excited to continue to bring that program forward.
Well, you know, and one of the questions that we also got is sort of similar to that in regards to sort of these partnerships that you might have. And Brian, one of the questions was asking sort of, how do you decide where you're still offering spin services and sort of some of the programs that you're talking about? You know, which cities were you picking? You know, how did you guys come together with deciding where that was?
Yeah, I think there were several factors involved in terms of figuring out where we would still continue to operate and how we will evaluate where to unsuspend operations. You know, if you look at the list of cities where we're still operating, you know, some of them are sort of obviously, just generally speaking, top tier markets, just in terms of population and density and just sort of general demand. Simple as that. Part of it also has to do with actually sort of what the city is asking or not asking us to do. So as an example, you know, we used to operate in Miami, but the county there, Miami-Dade County, has decided to ban scooters during the pandemic. So obviously we can't operate there. And then in some cities, we're operating because there are more use cases where we think essential workers would be actually using this on a regular basis. You know, maybe there are hospitals in the downtown core, et cetera. So some of those factors definitely were involved in that.
Yeah. Well, and you know, this goes to one of the questions that we've been getting, which is, it goes to sort of some of the bands of activities or how people have been deemed essential services or not. Do we think that on-demand mobility services are actually part of the fabric of the transportation and mobility landscape now? Or are they still something that's new and different enough that they're treated differently? And maybe, John, let me ask you to answer that question first, and I'd love for others to weigh in on that as well.
I'll take the easy answer and say it's too early to tell. I think there's different trends in place. On the one hand, this is a great lesson in how the nimbleness and the flexibility of these providers can adapt in ways that frankly probably couldn't have with any other tool set. But I think we've got real open questions in what the long-term effects for demand patterns are going to be because of COVID. A lot of employers might not go back to paying for all these buildings when they've adapted to work from home. People's attitudes towards urbanization may change. So I think we're still waiting to see what the long-term effects on demand patterns are going to be.
What are service providers from transit to Lyft, Uber, and Spin? Do you feel like it's an embedded program now, that it's when we talk transportation, it's part of that landscape? Carol?
Well, I guess I agree with what John said, but I do think I would lean towards yes. I think that these services, there's a lot of unknowns about where we're going to go and what demand is going to be, but I do think that they are or very close to becoming an integral part of the fabric and the set of options that at least in an urban environment like Seattle, for example, that people are still relying on and turning to. And so I do think that there's a lot we don't know yet about, yes, what's going to happen to vacancy rates in office space and what's going to happen to transit ridership, and is everybody going to, telework, how big of a mode is that going to continue to be? But I do think that we're thinking a lot about, as we look at public transit, like what is the right role for transit and how can these other providers, be part of the overall system. So I want to say yes to that.
Well, and that really leads into the question that I wanted to ask our participants, meeting attendees, meeting you. So get ready on your chat function. So here's your question as I send it out to you. Sorry, here we go. All right, send. Should MOD be considered an industry? And mobility on demand be considered an industry? So obviously we have many of the representatives on this panel right now, whether it's from our ride sourcing companies to our micromobility companies to our transit partners, and then obviously microtransit partners and others. But this is what I'd love for you to weigh in. Should it be considered an industry similar to airlines or transit or freight? Because that also speaks volumes as you start thinking about the future of COVID as we come out of this, especially as we start thinking about things like infrastructure bills and packages and policy that may address that. And so I would love to ask you about that, and sort of saying, do you think that MOD is an industry yet? And when we defined mobility on demand, I think the way that we describe it is on-demand mobility services that are backboned by intelligent transportation systems and dynamic systems management, so that it weaves together both the mobility services themselves along with the interactions on the customer sides on how they plan and pay for and interact with their trips, what we call traditionally mobility as a service or MOS services, with also how we think about operation services and management. And so how do we think about this industry? And I would love your thoughts in the chat and to be able to respond back to all of us, to all of our attendees, and how we think about that. And I think when we think rental is a part to that. So let me ask you this, Chris and Lily, do we think that MOD is an industry yet?
But it's an interesting term, an industry. I'd like to maybe even ask a little bit about that too, like what we mean by that. I mean, the way that I think of the word, I think it is becoming one. And I think it is becoming an industry that's like a part of the transportation industry broadly. I also think though that it's not like one of those, and I think when we think about modes, I think a lot of people agree on this call here, is that we don't want to think about them as just isolated modes like bicyclists and pedestrians and MOD riders, but rather that people use all of these aspects together as a basket of goods, if you will, a basket of transportation goods that meet all their needs, ideally instead of the private car, that you can take transit, that you can take a bike, that you can take an Uber or a Lyft and go. And I think that this is perhaps maybe a new component of that industry that feeds into the broader transportation landscape.
Yeah,
You know,
just
it's,
echo that and say, I
yeah.
think that I would say part of the crisis has shown how multimodal people are and are only willing to become more so. And so the system, the transportation system overall is becoming more fluid and seamless, and mobility on demand is a key piece of that, with transit as the backbone of how people can get around through shared mobility. So
Yeah.
I would totally agree.
Well, you know, it's interesting, and folks, you can, as you're responding right now online, and I really appreciate it. You know, a few of the comments that we're getting from you as the attendees, you know, I consider the industry as transportation modes, and we need sort of that combined mode of vehicle, whether it's MOD or the like. You know, another person mentioned, and this, I think this is an interesting comment. You know, is Lyft and Uber just different than a taxi, but it just has a better user experience? And so, you know, is all of that. But here, let me ask one. Consider that if it's an industry, such as those mentioned, it will be regulated. And then how are the different parts of that similar purpose for regulating them? Ellen, I think that you asked that. Could you raise your hand? There's a function also in your thing, because I'd love for you to expand on that a little bit more if you could. You'd hit the raise your hand function. So we're going to unmute you. If I could ask you just to briefly talk a little bit about what you mean when you say that. Unmuted her? There we go, Ellen. Perfect.
Airline industry is regulated, the taxi industry is regulated. Uber and Lyft are starting to be regulated, although in a variety of different ways. So just thinking about, I'm not sure how those different parts of, you know, shared bicycles and shared scooters and Uber and Lyft, how the different parts of those would fit together for purposes of regulation. So I guess that's why I would not think of it as an industry in that respect. Just like I think freight is not an industry, but big trucks are an industry.
I appreciate that, Ellen. Thank you so much for your comments. And you know, there's one more that I wanted to ask you, if you could stand on this, Ted. You mentioned this, and I'm going to read your comment. Yes, from the perspective of MOD providers, that they should be supported and protected during economic fluctuations. And as a society, we don't want to see these industries go away due to their inability to remain viable during a sustained pandemic. Could you raise your hand also? And if I could unmute you and just let you expand on that just a little bit more. And then I wanted to turn to Carol for some perspective on transit, since we've been getting a lot of questions there. But Ted? I don't know if we've gotten him unmuted or not. Ted Bailey, did you raise your hand? And I'm really adding your full name now. All right, that's okay. We can pass along there. But I appreciate your comments. And folks, as you can see sort of in the chat, you know, if it's an industry, one of the questions is, how does that help overall mobility in the cities to reduce that single-sider experience? And so with that, you know, let me turn to Carol. And Carol, you know, we were going to ask you to talk a little bit about what's happening in King County and how you guys are responding. And maybe you could sort of answer that question a little bit as well about those interactions with those partnerships, some of which Chris and Brian and Lily have also talked about.
Mm-hmm. Sure, and I'm conscious of time, so I'll be quick. But I think from a public transit perspective, managing through COVID has been a very fluid environment, and I would say, you know, public health and safety has been our #1 driver in our decision making, and that includes for our operators as well as our passengers. So, you know, it's a continuous refinement of service levels that we're operating, and we continue to make those adjustments to keep kind of balance loads with operator availability. But we are still carrying about 100,000 people a day, which is about 25% of our daily ridership. So we're still providing a lot of trips, really important trips for essential workers and others that rely on transit. And so I've loved this conversation in terms of the universal recognition, I think, of transit as an essential service. And I do want to piggyback on some of the comments that were made about, you know, using this as an opportunity to continue to recognize the essential nature of transit. And I think about that in terms of the way we use our street space, and, you know, giving transit priority to keep that essential service operating at its maximum effectiveness, and given also that we are entering a very unknown period in terms of revenues and ridership, I think that that's where the opportunity for partnering with mobility on demand providers gives us an opportunity to focus resources on markets kind of appropriately and doing that matching of markets to services. I think one of the other things I wanted to mention is just in terms of our response of what we've been doing. So in addition to like shrinking our fixed route bus service to provide those essential services, and I will say the biggest reductions we've seen in ridership is during the peak, which is, I think, to John's point, a lot of our choice riders are teleworking and may or may not come back at the same level as they were riding before. But we've been implementing a couple of different on-demand types of services that are really kind of unique, I think. The most unique is probably one we call transportation for pandemic response. And that's really focused on moving COVID infected patients to healthcare. And so that's been a really rewarding and unique opportunity. And the way we're approaching these partnerships is really to work with our existing contractors first, because we can enter into those relationships quickly, but also we want those contractors to be resilient and be able to come back after the crisis is over. And so I think as we look at other mobility on demand providers, I mean, I think that that's an important thing, right? What is the resiliency and the ability to come back after this crisis and fill in those their parts of the network. So the TPR, the Transportation for Pandemic Response, has been, we've retrofitted vehicles with barriers between the drivers and the passengers. We've kept the fleet separate. We've provided pay differentials for the cleaning staff and the drivers, and it's been a great experience. So we've used our contractor on our access and paratransit for that service. We've also partnered with a lot of different organizations, community organizations and providers to deliver essential goods and services. So that's the food bank deliveries and grocery stores and pharmacies and we may be expanding that. And then we're actually just right now going through a process of potentially shutting down or looking at how we could shut down our night service and looking at whether we can do a software as a service type solution with union operators and union vehicles to capture that market. So there's a lot more going on, but I am very conscious of time. So I think that as we look towards the future, I mean, we do want to use this, and I think many of the speakers have said this already. I think this is a seminal catalyst moment that we should all be thinking about how we build on the positives that may come out of this, and how we use our infrastructure and our resources, and how we hone our focus, how we hone our focus in public transit to move the most people that we can move in the best way, and how we look to others to partner with us, to round out that transportation network.
Well, and Carol, I think a lot of people have been asking some questions about sort of back-end service platforms. Someone had, was curious with Chris, hey, could you use Uber platforms to start creating sort of different on-demand services? Via's another group out there. Could they request service for transit on these back-end systems? And John, I'm going to turn that to you too, because I think that, some of those questions about these back services that facilitate transit and ridership and mobility. What do you think, Carol, as you look at that?
Well, I mean, that's the one idea that we're exploring right now, as I mentioned with our night owl. And in fact, we are looking at, we have a contract with Via that we had to suspend our mobility on demand pilot, which Via the Transit, which was a very successful pilot, but due to social distancing, we weren't able to keep that running during this time. But we are looking at that platform and saying, can we use that software platform to do some, on-demand typed fixed route service for our night owl to really help manage the demand for that service. I mean, part of what we struggle with our night owl service is also what we call non-destinational riders, and we're actually seeing a lot of overloading on those services, overloading in COVID terms, meaning that, everybody's got a seat, but there might be two people in a seat, which is what we don't want, right? Yeah, I think that that's something that we're really interested in exploring and could have potential in the long.
And you know, one of our attendees asked the question. I'll turn this to John as he sort of chats a little bit. You know, should we broaden the definition of transit just to include all of these mobility on demand services as you think about MT as it moves to the future?
Should we broaden the definition of transit? I don't know if I'm the right person to answer that question.
See, I thought I'd ask the non-transit, the non-Lyft people that, sort of the generic response.
I like the approach of looking at the system as a whole. The theme that interests me the most in all of this is one that both Carol and Lily have brought up, is how does this change our approach to the resiliency of the entire system? We've seen some great examples of where the nimbleness and flexibility of these providers have met a need that we couldn't have met otherwise. But that can cut both ways, because we've also seen cases where due to economic disruption, people may be faced with a loss of a service that they've come to depend on. So building a resilient system, when you build it one component at a time, is a really complex and challenging problem. I think the best way to get started on that is to just ask the question, when you make a new addition to the system, from a system-wide perspective, are we creating a redundancy which makes the system more resilient, or are we creating a new point of failure and hence a new vulnerability to the system? The first step is asking the question. Sometimes the answer is going to be, yes, we're creating a new point of failure, and that's okay, as long as we acknowledge that and plan for that. And I think planning for that in this context means that everybody has a plan for when the other guy fails. That's not as simple as saying everybody needs to have a business continuity program, because business continuity plans typically just protect the interest of an individual stakeholder, individual organization. We want those plans to have a composite effect of making the entire system more resilient. And that requires visibility into each other's vulnerabilities and visibility into each other's plans, which is a really tricky problem when you've got a mixture of public and private sector entities. But I think it's a discussion we're going to have to move forward, and COVID's a great example of why we need to.
You know, that's a really interesting point. And I think that, you know, right now we've talked about the fact that mobility on demand in some ways breaks down the silos of what's happened in transportation. It used to be highways and transit and taxi services, and they were all in their own sort of space, but they've become more blended, and especially with the emergence of mobility, on-demand mobility services, which put it at the power of this in the fingertips of folks. And guys, just as a time check, we're nearing the hour. I'm going to go for about 10 more minutes, just briefly, and if anyone has to drop, please know that we're recording this and we'll continue to do it. But I wanted to ask a couple more questions, because we've had a lot of questions come in about not just moving people, but moving cargo. And especially what that means in regards to these essential services as you move that. And back to your point, John, about resiliency of the system, and we recognize that so much of our system has been reliant on the fact that cargo deliveries are still moving, whether it be food or others. And maybe, you know, for Lily and Chris, and even Carol, because I know some transit agencies have moved into some of this space, how have those essential services and those programs changed? Has that changed potentially your business model? Has it been your ability to keep your drivers and engaged and you know, employed, for instance, during these times? You know, how have you guys been looking at some of that? Maybe Lily, I'll turn to you first.
Yeah, thanks for the question. As I mentioned in my remarks, we're really focused on the sort of the short-term and immediate impact we can have by filling in gaps where needed or augmenting existing services. So, for example, delivering meals through the school systems to families who can't access those. Many school systems have set up sort of grab-and-go centers, but if you don't have a car, how would you get there? And so that's an area where Lyft can fill in the gaps right now. And we're really focused on sort of those opportunities and on the crisis at hand, and aren't really yet focused on sort of a longer term delivery component to this.
Gotcha. How about you, Chris? Yeah.
Sure, and thanks, Lily. I think you know, Eats has obviously been a big part of the expansion that we've seen. A lot of people getting like Lily was mentioning, food deliveries at home, people working from home, or people who can't go out. It's been a good way also for restaurants to be able to maintain at least some semblance of a customer base if they can't do dining options. I think what's interesting too is as this does drag on and could go on for a while now, it'll be interesting to see how, instead of getting people to places, can we get things to people, whether they be delivery of groceries or pharmaceutical items, or even people sending packages to each other. And if you think of mobility on demand as this mesh network of transportation that kind of sits in a city with 2 to 5 minute access times in most places, it's almost like dropping in a package and someone picks it up and drops it off somewhere else, whether it be food or groceries or a trans agency tapping into it. There's a lot of possibilities here if we start seeing this instead of as like a separate piece of the transportation network and more of as this underlying piece, kind of like tap water. You just tap into it. Could we potentially tap into this transportation network to do deliveries or regular passenger transport?
Yeah, and it's been interesting, Carol, one of the things that I've seen, for instance, I'll use Denver as an example, since they're my backyard, transition their accessoride services. So instead of taking their passengers to the grocery store, they're bringing the groceries to the passenger. So they just sort of flipped the order. And is that a new paradigm for transit as you start thinking differently about what kind of services you offer post-COVID?
Yeah, that's a good question. I mean, I'm not sure that I'd say that's a new paradigm, but it might be a tag along service. But I think it really depends. I mean, we are doing that right now. I think Metro in this region has become kind of a clearinghouse, right? We get a lot of requests from various entities, community-based organizations, et cetera, that are looking for help getting essential goods and services to their customers, members. And so we're kind of being a middleman there, facilitating that, again, using a lot of our existing contractors to deliver those services. I think, that it's an interesting question if you could combine those things, because I don't know that public transit would take that on as a separate. I mean, we've talked about goods and service delivery goods delivery for 20 years, and I'm not sure that that's a primary focus for public transit market. But I think it's an interesting question whether it could be combined with people delivery.
Yeah, it's one of those interesting things. And, I think a lot of people ask right now, sort of post-COVID, are all bets off where how we traditionally thought about transportation and mobility. And, someone made a comment that he agreed with John's comments about a common resiliency plan, but the difficulties might be in how you merge resiliency and recovery plans between a public and a private sector. That those two can be copacetic at sometimes, and then perhaps have very different motivations, very different cultures, and what's trying to achieve with that, which I actually think is a really interesting point. A lot of questions. Yeah, go ahead.
Yeah, I'll just quickly, just to add something to this discussion. I think it's important to keep in mind, though, that when we're talking about this question of whether transit or MOD should be an industry in and of itself, and what should or should not be part of that definition, I think it's good to keep in mind that all of the modes here are regulated differently by different jurisdictions. And so there's a natural sort of tension there that, in my opinion, I think would initially be sort of hard to resolve. For Uber and Lyft, for instance, they're mostly regulated at the state level. We are pretty much exclusively regulated at the local government level. So even if we were to try to think broader and expand sort of the definition of whether this is an issue or not, I think you will see those turf battles happening between the jurisdictions as well.
Well, that was exactly the question that I was just going to ask. So, and I'd love other thoughts about that. Bruce asked, what factors will accelerate sort of that closer working relationship between city to public, or even then to our mobility on demand providers? And, do we, as we especially think, if let's say federal reauthorization comes down the pike as a way to jumpstart the economy, where more dollars flow into transportation, and some of those dollars flow to these types of services. Some regards, these services are too new. It's not baked in quite yet into how we think about things from a federal funding perspective. So what factors should we be thinking about that would accelerate these relationships? And Brian, maybe I'll start it with you, and then we'll kick it off to the others.
Yeah, sure. I think, and I'm speaking just specifically to shared micromobility, obviously in my case, but I think when dockless mobility first came on this scene, most local cities, began to regulate us based upon what they knew, which is public subsidized traditional docked bike share systems that are usually, decided through single vendor RFP in a multi-year contract. And I think because of that, because we are, a private sector entity, there was a little bit of a regulatory mismatch, right? Obviously we can't discount that the city does want equitable service and equitable distribution and accessible and affordable rides and what have you, but we're also not getting any public subsidies. And so there is that tension, and I think this pandemic is actually causing many of our city partners to sort of rethink that general approach. Oh, maybe it's not the end of the world if we don't always treat spin like a normal, typical, publicly subsidized contractor, for instance. And I think that will sort of help accelerate, because at least from our perspective, our aim is to really focus on the long term. How can we make sure micromobility a sustainable model so that our communities can depend upon them, and that we can have a viable business model where we are still around for years to come?
Chris and Lily, I'll let you guys answer that. And then I'm going to turn it to one last question to our audience. And I'm going to hit it to your chat thing right now as you look at that. And I'll come back to our panelists for their thoughts too. So Chris and Lily,
Sure.
thoughts about sort of areas to break down partnerships, and also with that thought of equity and accessibility, that becomes a common topic. So Chris, go ahead.
Absolutely. Yeah, I was going to say, I think one example that's come to mind is the way that we, define public transportation, and how do we then, I think someone else had brought this up, is like, how do we wrap in the MOD modes into the transit mode? And right now it's a little bit of a gray area, how it's defined federally. How does UberX and regular Lyft rides, how do those fit into the broader concept of public transportation? And I think those kind of questions have to be answered. And like we said, they're kind of still new, but I think this is the time to answer those questions, both in federal funding policies and in local funding policies as well.
John and Lily and Carol, any additional thoughts?
Yeah, I would just echo what Chris just said, and say that Lyft's perspective is really on establishing strong public-private partnerships. So deep working relationships with cities and transit agencies to understand what the challenges are, what the service efficiencies needed are, and then finding ways to plug in those gaps is really how we've always operated, and how I think we'll continue to deepen relationships, public and private, going forward. I think in this COVID crisis moment, we've really seen the strength of that partnership only increase, and the resilience and the redundancy that we can build into the system by having multiple options on the ground for people to choose from is really more important now and in the recovery than it ever was before. So I'm really hopeful that together as an industry, we can come together and really meet the needs of the traveling public through all of these modes in a way that reduces reliance on private cars.
Yeah, I appreciate that. Thank you. John, last thoughts on that?
Never waste a crisis. The technology behind all these systems is certainly here to stay. We may well see some evolution of business models towards more sustainable models. But yes, I think the core technology is here to stay, and will get only stronger.
And, one of the questions that I asked all the rest of the attendees is, how does mobility on demand and on-demand mobility emerge from this? Is it stronger? Is it weaker? Is it just different? And, some people are offering some thoughts, and I'll just sort of share some of them with you as we go. Stronger potentially on the freight side. Weaker potentially on the pooled side and sharing rides in transit. Someone also made an observation that it's ensuring that different modes aren't subsidized more than others. And Jeremy, if you could raise your hand, I'm going to let you expand on that for just one last comment, and we're going to unmute you, so maybe you could just weigh in on that for 2 seconds.
Yeah, so I think that so I come from a car sharing background, and I think that car sharing, kind of also similar to scooters, gets charged a lot in North America. And I think that instead of it being subsidized by the government, it's actually subsidized by developers or the private public, essentially. And so you then see costs that are then different because there's less money for the business model to actually make money. Whereas let's say like using like Uber and Lyft is a good example. There may be some taxes in certain areas, but the cost isn't necessarily for the company. It's just on a different way. So it's ensuring that when you do a subsidy for a mode of transportation, it actually doesn't create actually a favorable outcome for one versus another. Because let's say a car share model, you have to pay for parking. Well, if they do a subsidy but don't take account for that parking cost, then the subsidy kind of unbalances the whole mobility landscape.
Thank you. I appreciate that. That's a really interesting comment. And I think especially as we consider sort of what's moving and what's coming as we look at potential restart policies and thinking about where this entire landscape goes. And folks, we're at our time now. I did take it exactly to 3:10 if you're Eastern time, 1:10 if you're Mountain Standard Time for me. And I just wanted to make a couple additional comments, as we look at this, a reminder I think that people have made, that essential workers must be provided with essential transportation. And so how that emphasis on equity and what that is being front and center and how we think about this, I think it is an important consideration as we continue along. But thank you so much to our panelists. Thank you to the audience who weighed in with your thoughts. Unfortunately, I think I thought that all of you could see all the comments that were coming through on the chat, so you could see what your counterparts were having to say. But what we'll do is we'll group all of this up. We're going to put this together. As you know, we were taping this, to use an old-fashioned term. We will be posting that online through social media. And I'll do some of the same with some of the comments so that you can sort of see some of the back and forth. What we might also do is we may come back here in a few months and revisit these same discussions, because I think that we'll have more insight and knowledge about where we're going and how we want to continue with all of this. And again, thank you all for taking the time to join us. I think mobility on demand as we move forward is truly part of how our transportation landscape moves both people and cargo, how we think interactively about our infrastructure. Unfortunately, we didn't have time to get into the infrastructure side of how it supports mobility on demand as we move forward. And I think that that could be a conversation for another time. But we appreciate the participants, and stay tuned with other mobility on demand activities, and we'll continue to engage in all of these discussions as we move forward in the future. Thank you again.